So today I'm going to be doing my insulin injection or my subcutaneous. Some areas that you can give a subcutaneous injection are the back of the arms, scapula, abdomen, and then the back of the thighs as well. I'm going to use a 28 to 31 gauge and a 1/2 inch to 5/8 inch needle for this. I'm going to first make sure I have the right client, right dose, right drug, right route, right time, and right documentation for this. Then I'm going to check for any allergies that the client may have, as well as checking Skyscape for anything that I may need to know regarding like administration and all of that. Then I'm also going to check the client's blood glucose level before I draw up anything, because regular insulin is given on a sliding scale. So based on what that patient's blood glucose is how much regular insulin I will give, and then MPH is given once a day. So whatever that client's MPH is that is already prescribed is what I would give. But I'm going to make sure to wash my hands before touching any of the medication or anything like that. And then I would cleanse both the regular and MPH because they are multi-dose vials. Then I would push air or roll the MPH to make sure it's well reconstituted. Then I'm going to push air into the regular insulin and MPH at the same time. Then I'm going to draw up the regular insulin first, check for any air bubbles. Then I'm going to pull the MPH. With MPH, you can't push it back into the bottle since it is now contaminated with the regular insulin that is already in there. Then I'm going to check for any air bubbles there. I'm going to ask my clinical instructor and another RN on the floor to check and ask them what units do they see, how many units do they see here. And then if it were wrong, I'd have to completely start over. After drawing up the insulin, I'm going to put it back in the fridge since it is a multi-dose vial. Then I am going to go to my client, cleanse the area. Then I'm going to see if I can pull up 1 inch, which is going to be a 45-degree angle, or 2 inches, which is going to be a 90-degree. I can pull up 2 inches here, so I'm going to mark it with my alcohol pad, grab my dose, drop the alcohol pad, drop my 2 inches, go in at a 90-degree, inject. You don't have to aspirate, pull it out, and then throw it into the sharps container.